Assalamualaikum. Bismillahirrahmanirrahim. In the name of Allah, the most beneficial and the most merciful, today I will talk about kidney stones. What are the kidney stones? How we can diagnose on ultrasound and clinically. What are the types of kidney stones and how kidney stone looks on ultrasound? First of all, look at this pic. This whitish thing inside the kidney is called stone. This is renal stone. There are two stones in this kidney. If it produces the blackish shadow behind, it is called renal stone, but if it does not produce any blackish shadow, it means it's not stone, it is concretions, which is called renal concretions. In this pic, inside kidney, there are two renal stones which produce blackish shadow. Carefully look at this pic. These are renal stones, not renal concretions. Again, look at this picture. Urinary bladder, inside below urinary bladder, the blackish thing which is called stone, and behind stone there is a blackish shadow which confirms that this is stone, not concretions. In another pic, in right kidney, look at this whitish thing. This is stone, renal stone, and behind renal stone there is a blackish shadow behind this which is called renal stone. In first two images, you will see the blackish shadow. It produces the whitish thing, and behind this whitish thing the blackish shadow which confirms that it is stone. It is called renal stone. But in last two pictures you will see the whitish thing which does not produce any blackish shadow. It means these are renal concretions, not any renal stones. Please carefully understand the difference between renal stones and renal concretions. If whitish thing it produces blackish shadow, it's called stone, otherwise it's concretions. Look at this pic. This whitish thing, it is called renal stone, and behind renal stone there is a blackish shadow which is called renal stone. Blackish shadow means stone, produced shadow means stone. Look at this picture. This whitish thing is a renal stone, and behind renal stone there is a blackish shadow which confirms that it is renal stone, not any renal concretions. Measure its size and then we will manage it further. Now look at this pic. These two whitish things, these are called renal stones, and behind this whitish thing there is a blackish shadow which confirms it's renal stone. I am showing you pics again and again so you can easily differentiate between renal stones and renal concretions, because these are very important on ultrasound. Now look at this video. This blackish thing, this is called renal stone. Look at this pic. Behind whitish thing there is a blackish shadow going which confirms that this is renal stone. There are two renal stones in kidney which confirms there is some problem. Now we will discuss epidemiology of kidney stones. The lifetime risk of kidney stone is about 10 to 15%. Kidney stones are more prevalent in hot, dry climates such as mountain, deserts, and tropical areas. The highest incidence of kidney stone is in the summer month from June through September. The risk of kidney stone disease correlates with weight and BMI. About 60% of those with kidney stones are men. Mostly men are affected by kidney stones. Symptoms: fever, stomach pain, vomiting, dizziness, blood in the urine, and backache. These are the major symptoms of kidney stones. There are many types of stone like cystine stone, calcium stone, uric stones, and steroid stone. These are the major types of kidney stones. Please drink more and more water so you would not suffer any kidney disease. Calcium stones, these are formed due to the excess of a mineral called oxalate, commonly found in some fruits, vegetables, nuts, and chocolates. A steroid stone is less common and caused by infection in the urinary tract. It can It can grow quickly and become quite large. Uric acid stones form due to the chronic dehydration. The risk increases in those with gout, a genetic tendency, or diet too much protein. Cystine stones form in people with an inherited disorder that caused the kidneys to excrete to an excess of certain amino acids. Xanthine stones, they are caused by an enzyme deficiency that causes the buildup of xanthine deposits. Silica stones are rare and caused by certain medications or herbal supplements. These are about the kidney stones.